Welcome to Podocyte Talk. In today's episode, we're discussing 3 new studies that highlight important advances in nephrology, ranging from the expanding use of SGLT2 inhibitors in advanced CKD to the potential of anti-nephrin antibodies as biomarkers in glomerular disease, and the intriguing connection between cardiac therapy and vascular access flow in hemodialysis patients with heart failure. Let's dive in. We begin with a systematic review and meta-analysis assessing the efficacy and safety of SGLT2 inhibitors in patients with advanced chronic kidney disease, defined as an eGFR 30 milliliters per minute per 1.73 ml per water. While SGLT2 inhibitors have proven benefits in earlier CKD, data for their use in more advanced stages has been limited. This study reviewed 10 Phase 3 randomized controlled trials, focusing on over 4,800 patients with advanced CKD. The researchers compared patients receiving SGLT2 inhibitors with those on placebo and evaluated outcomes such as progression of kidney disease, kidney failure, and cardiovascular events like heart failure hospitalization or cardiovascular death. In patients with eGFR 30, SGLT2 inhibitors significantly reduced the risk of major kidney outcomes, including progression to kidney failure or death from kidney or cardiovascular causes. While the cardiovascular benefit was less clear in this group, there was still a favorable trend. Importantly, these benefits were consistent with those seen in patients with more preserved kidney function, eGFR 30, and there was no signal of increased harm. The rates of adverse events were similar between SGL2 and placebo arms, indicating good tolerability. So what does this tell us? SGLT2 inhibitors continue to offer renal and potential cardiovascular protection, even in advanced CKD, and can be safely used in this population. This supports expanding their use into later stages of kidney disease, rather than withdrawing therapy as eGFR declines. Next, we turn to a large observational study from China that examined the presence and clinical implications of anti-nephrin antibodies in adults with minimal changed disease, MCD, and primary focal segmental glomerulosclerosis, FSGS, 2 of the most common causes of nephrotic syndrome. These antibodies have been recently proposed as potential biomarkers in glomerular disease, but their prevalence and clinical relevance in adults were not well established. The study included 596 adult patients, with 436 diagnosed with MCD and 160 with primary FSGS. Using ELISA and additional validation techniques, researchers tested for both anti-nephrin IgG and IgM antibodies. They found that 43% of patients tested positive for at least one antibody type. IgG was present in 30%, IgM in 26%, and 13% had both. These antibodies were more commonly detected in patients with nephrotic range proteinuria who had not yet received steroids or immunosuppressive therapy, with a prevalence exceeding 50% in that group. Clinically, antibody-positive patients had more severe proteinuria, shorter remission durations, and higher relapse rates. Those with both IgG and IgM had the most aggressive disease course, suggesting a dose-dependent effect. Interestingly, longitudinal analysis showed that antibody levels dropped during remission and reappeared before relapse, pointing to a role for these antibodies in disease monitoring. This study highlights that anti-nephrin antibodies may not only reflect disease activity, but also predict relapse, making them valuable biomarkers and potential therapeutic targets in MCD and primary FSGS. And finally, let's move into the third study, which explores a fascinating intersection between cardiac function and dialysis access health. Specifically, this study examined how Sacubitril Valsartan, a medication used for heart failure with reduced ejection fraction, HFrEF, affects vascular access flow, QA, in patients on hemodialysis. The study included 33 hemodialysis patients with HFrEF, divided into 2 groups, those treated with Sacubitril Valsartan and those receiving standard care. Researchers measured left ventricular ejection fraction and vascular access flow at baseline and after 12 months. Among the 16 patients who received Sacubitril Valsartan, QA significantly increased over the study period, from approximately 634 to 949 milliliters per minute. Their LVF also improved, with an average increase of over 13%. In contrast, the non-Sacubitril Valsartan group showed no significant change in QA or LVF. Further analysis showed a strong correlation between improvement in LVEF and increased access flow. Patients with better cardiac function also had better perfusion through their dialysis access. A regression model further supported this link, showing that changes in LVEF and interventricular septum thickness could predict changes in QA. This study suggests that in hemodialysis patients with HFrEF, sacubitril valsartan may not only improve cardiac performance, but also positively impact dialysis access function, a crucial part of ongoing renal replacement therapy. It offers a new perspective on how optimizing heart failure treatment could support vascular access health. Thanks for joining us on Podocyte Talk. Be sure to check the description for links to all 3 studies and subscribe so you never miss an episode. We'll be back next week with more clinical insights and research updates in nephrology.